patient head to toe. Knock, knock, knock.
Come in.
Hello, I'm Michelle, and I'm going to be your nurse today. Can I get your full name and date of birth, please?
John Doe.
John Doe. And I'm just checking your name and your birth date.
9375.
Okay, and I'm looking for any allergy bands. Do you have any allergies? It says no drug allergies here. Is that correct?
Correct.
Okay. So why I'm here today is I have to do a full head-to-toe assessment, and that requires me asking you questions, also exposing you and physically touching you from head to toe and going through the systems. Would that be okay?
That would be great.
Okay, I'm going to just provide some privacy for us. Just going to pull this curtain a little bit.
Good.
And do you know what day it is today? And
It's Thursday.
just going to raise your bed here while I ask you some questions. Do you know what month and day of the year it is and where you are?
April 14th, and I'm in the hospital.
What brings you into the hospital, John?
I broke my left leg.
Okay, how'd you do that?
Snowmobiling.
Okay, so I'm raising the bed to my height for a working level. Are you comfortable sitting in this position, John?
Yeah, I like it. That's nice.
Okay, I'm going to start with taking some vital signs here. There we go. Come on, let me do it. Pretend this is not there. Oh, it's attached to you somehow. For the purpose of this video, we'll use this one.
Yeah, there's a couple. He's connected. Mm-hmm.
Okay. So it's going to pump up and get tight. Start that by machine. Just going to check your temperature here, pretending.
Mm-hmm.
Looking for any hearing aids or anything like that. Am I seeing any?
No.
98.6, perfect. And I have a sat monitor here. I'll pretend. Just going to put it on. This is going to measure your oxygen saturation. I'm looking for a 95 to 100% oxygen saturation. Is that room there? And John, I have to expose your chest and just listen to your heart for 1 full minute, okay? So
Okay.
as I'm exposing the chest, I'm looking for skin integrity, color condition, any lesions, anything like that. I'm going to go midclavicular intercostal space for apical pulse, and I'm going to listen for a full minute. Okay, so a whole minute's been up. I would actually continue on another 30 seconds, counting respiration so that John's unaware that I'm doing that. Pulse was regular, equal at about 80. And respirations are equal bilaterally. Nice chest rise. Say about 16 a minute. Perfect. John, are you having any pain at all?
Yeah, my left leg hurts.
Okay. Whereabouts on your left leg?
Kind of the whole thing. It's kind of throbby.
Okay, that's what it feels like then. That's the quality of being throbbing. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain you ever had, what would you rate that pain?
About a 2.
Okay, 2. Does anything make it better?
They gave me some pain medicine.
Did that help?
Yeah.
Okay. I can check in your orders to see if there's maybe another order due that we can give you to decrease that. Your goal for pain is 0, I assume?
Yep.
Okay, so I'll see if you're due for that. Does anything make it worse, the pain?
Oh, if I lift it up, lots of pain.
Okay. How about when you get up and walk or anything like that?
Yeah, it feels heavy and throbby.
Okay. Well, maybe the pain medicine will help with that. And I'll check the orders as soon as we're done with this. Is that okay? Is there anything I can do? Can I prop it up for you at the time?
No, she just came in and propped it, so I feel pretty good now.
Okay, great. Great. Okay, well, I'm going to just start by the assessment real quick by just looking at the head, looking through your hair, anything like that. Can you lean forward at all? I'm going to check the back of your head. So I'm checking the back of the head and neck area. I'm looking, I have a pen light, so I'm going to look in the ears and behind the ears. I'm looking for any drainage, any bleeding, hearing aids, any hardness or any problems hearing at all, Jen?
No, I'm pretty good. I got good hearing.
Great. And I'm looking over here. I'm going to turn your head to the side. Okay, great. I'm looking for drainage as well. Or looking behind the ear. It's great. Can you give a big smile?
Big
Puff
time.
out your cheeks. I'm looking for facial symmetry. I'm looking with my pen light in the eyes for pupils to be equal and reactive to light.
Good.
Saying you're 4, equal bilaterally and brisk to light. I'm going to look up the nose, make sure there's no drainage or discharge or bleeding, and that they're clear and open, it's patent. I'm going to open your mouth. I'm going to look in there, make sure the oral mucosa is nice and moist, no trauma, no lesions, no problems there. Everything looks good, there's no swelling. And then I'm going to just feel your neck and inspect it for any lesions, skin color, temperature, condition, crepitus, anything like that. Any problems swallowing or breathing?
No, it's pretty good.
Okay, can you go ahead and swallow? Oh, perfect. No pain there at all?
No, no pain.
Just feeling your neck. Okay, great. Now I need to move down to your chest here. I'm going to listen to your lung sounds. Are you able to sit up, John?
Sure.
Okay, so this is a heavy mannequin, Erica, but I'm pretending he's sitting straight up, if that's tolerable to him. And then I'm going to place my stethoscope bell in between the intercostal space and listen for a full inspiration, expiration with an S pattern. So I listen for full inspiration, expiration, inspiration, expiration. And I'm looking to make sure that they're clear and equal bilaterally, and there's no wheezing or crackles or rails or rhonchi. And it was all clear when I listened. Also, again, inspecting the chest or anything like that. Are you short of breath at all with activities or at rest ever or anything like that?
Nope.
No? Okay. And then I would also check, while you're sitting up, I'm going to also check the back. So I would inspect the back, skin color, temperature, condition, and I would do a reverse Z pattern. I don't know if I can do that. Okay, well, there we go. We're up. Great. So I'm going to do a reverse Z pattern. Full inspiration, expiration. Okay, great. Okay, John. Well, I know you have shortness of breath, but because you're in the hospital and you're more immobile than you are typically, especially with that fractured leg and the hip that you saw had surgery on it, we want you to use this incentive spirometer. What it does is keeps your small airways open and it prevents pneumonia. What you do is you wrap your lips around the white piece and do not blow. Instead, you suck in and you make this ball go up right into this area of the smiley face. We want you to do that 10 times per hour in the hours you're awake. So can we give it a try? Perfect. Once more? Oh my God. Great. I'd also advise practice some deep breathing and coughing. You'll turn your head, cough, and then breathe in deep and then out, okay? And that'll help to prevent any pneumonia or any breathing issues while you're here with us. Do you understand or have any questions with that?
No.
Okay, great. So now I'm going to check your extremities, and we're going to start at the shoulders. I would expose the skin. I would take this down, make sure shoulders are intact. I'm looking for any pick lines. I also need to check the elbows for breakdown, make sure I look at the whole extremity. Anything like that. Fingers in between the fingers. Checking this one. I'm checking for skin color, temperature, condition, and fractures, any swelling, any issues. And checking the elbow, back sides, between the fingers. Problems with that. I'm going to have you grip my fingers here and squeeze real tight. John has strong, equal bilateral grasps. Just check your pulses here at the same time. Nice, strong, equal bilateral pulses, no weakness. They're not thready or bounding. It's normal. I'm going to check capillary refill and make sure it's less than 3 seconds. We're at 2 seconds. 2 seconds. Do you have any numbness or tingling in your hands, John?
No.
Okay, great. excuse me. Okay, now I'm gonna check your abdomen. So, we're gonna inspect. I'm looking for color, temperature, condition, integrity, making sure there's no lesions, anything like that. There's no G-tubes or anything like that that I see. And first I'm gonna look, and then I'm gonna listen. Just gonna listen for your vowel signs in every 4 different places, okay? And I'm gonna listen for 1 full minute each, okay? So 1 minute. 1 minute. 1 minute. 1 minute. If I didn't hear vowel sounds, I would listen for a full 5 minutes in that quadrant and all other quadrants, and then document that and call it provided. And then I'm going to palpate, okay? You tell me if you have any pain or tenderness with it. So I'm checking to make sure the abdomen is soft, non-tender, non-distended, without any gardening or rigidity, and it's soft, non-tender, no rigidity or distension, anything like that. Just going to check your peri area here while I'm down here. I don't see any Foley catheters or anything like that. Skin color is good, and it's clean, dry, and intact. Do you have any nausea, vomiting, or diarrhea at all, Jen?
Nope.
And when's the last time you had a BM?
This morning.
This morning. And any problems with that? Was it normal bowel movement?
Just normal. I did good.
Are you able to pass gas?
Yes.
Okay, great. I'm going to have you just turn on your side if that's possible. Maybe you want to come to this side since that leg's broken. And I'm just going to, actually, it would probably be easier since the cast is heavier to just keep that down. Maybe turn to your side. I'm going to check your buttocks area and your back. Okay, so I'm checking skin color, temperature, condition of the back again. I'm checking the coccyx area to make sure there's no skin breakdown, any lesions, any discoloration. I'm checking moisture, making sure there's no moisture, dealing with that. Everything looks real good. And when is the last time you waited or went to pee?
Like an hour ago.
Like an hour ago. Any problems with that? Any burning, pain, hesitation, urgency, or frequency?
No.
Okay. Now, are you incontinent of either bowels or your urination? I mean, do you wear incontinence pads or briefs, or do you get up and use the toilet? Or
I can go by myself. I don't have to wear it depends.
Okay. Do you use a bedside commode, or do you go to the toilet?
No, I can still go to the toilet.
Okay, perfect. Okay. Well, since I'll probably be looking for your order for pain medication, we prefer that you call in or use your call light to call us so that we can kind of walk with you. It can make you dizzy and a little sedated. Will you go ahead and do that for us next time you need to get up?
Yes, I promise.
Okay, sounds good. Now I am going to check your lower extremities. I'll try to be careful with that left leg. Is that pain still a 2?
Yeah, it's a 2, but it's, it's okay.
Okay. So I'm looking, I assume that's, where did you break your leg at?
I broke it in the middle.
Right in the middle, okay. So a cast would be above the knee and then including the entire foot. So I won't be able to visualize that, but I would visualize all the exposed skin that I could on that limb. Making sure the skin color, temperature, condition is good. Nice, warm, dry pink. That's good. And I don't see any edema or anything here. And I'm going to palpate here for any crevice, skin color, temperature, condition, moisture, and looking for swelling, pitting pedal edema. And I would rate that up to the scale of 4.
Clean for 30 seconds, let it dry until dry.
I'm going to check bilateral pedal pulses. It may be covered here. If it is covered and I'm unable to do it, I would document that in my charting, why I couldn't assess it, and I would go by skin color, temperature, condition, and also cap refill, which is less than 2 seconds. It looks good. Here, less than 2 seconds. This pulse is nice and strong. This one's covered. I'm going to go ahead and look at the back of the legs. I'm going to look at the bottom of the foot. I'm going to look at the heel for breakdown, the top of the foot, in between the toes. There's no problem. Just checking here in between the toes. Is that okay? Does that hurt you at all, John?
No.
I'm going to check just this bottom portion that's open.
Feels a little tingly though.
You got a little tingly in there? Did it feel numb at all?
A little kind of weird, numb and tingly.
Okay. I want to make sure there's enough room in between the calves and it's not cutting in or too tight. And there is room for me to get my finger in, so probably just a little bit of swelling. I'm gonna make sure and monitor that, skin color condition. How about on this foot, any numbness or tingling?
Nope,
over
that one
here?
feels perfect.
That one feels good. Wiggling your toes, can you do that?
Yep.
Oh, perfect, thank you.
And then I would label. I would label date, time, and
So when you're in
result.
bed, do you need any help moving in bed or turning or anything like that?
No, I can do it on my own.
Okay, well, we encourage you to, move about in bed every couple hours, at least change your position, okay? Then we don't have any areas of skin breakdown and less problems with that. Do you understand that?
Yeah.
Okay, how about when you transfer from the bed to like a chair? Do you need any help with that, or do you use any devices?
No, but I gotta have my crutches pretty soon.
Okay, how do you do with the crutches? Pretty well?
Yeah, they taught me how to use them.
Oh, perfect. Okay, so when you're walking, you ambulate, that's walking with crutches as well, and you don't have any problems with that. That's great. Again, though, give us a call on the call light before you get up. I just want to see how you're doing during my shift since I'm unfamiliar, and make sure you're not too sedated or dizzy when you get up, okay?
Okay.
I'm gonna go ahead and raise this up for you here. And I'm just gonna lower your bed. Are you comfortable in the position you're at now, Joe?
Yep.
I'm gonna put bed in low position here. Your call light for us here is right on the bed. It's the nurse pinkish light there. You can give us a call. I'm gonna make sure the room is free from clutter. So we can move this. Sure. It's free from clutter. Make sure you have your water. Water pitcher is full. Not within reach. There you go. Again, my name is Michelle, and if you have any questions or anything you need whatsoever, you please don't hesitate to call. Is there anything else I can do for you at this
No.
moment?
Thank you very much.
Okay, I'm gonna check on those orders and document this, and then see if you're not due for more pain medicine, and I'll be back shortly.